Good morning. You hear me now?
Yes.
It's better? Good morning, everyone. I am happy to share my experience with my friend from Africa, our motherland. And first of all, I want to thank my dear friend in China to arrange this meeting, which is very important. The screen is okay, Jenny?
Yes, Dr. Mohamed, we can see your screen.
Okay. My story is starting since 2012, and I am different as a HIFU believer because I am searching for the technology, not the company or anyone offered it to me. I searched for the technology, and I found that the Chongqing University and the Chongqing technology is the best one. So I traveled to China many times since 2011 till we can bring this machine by the assistance, a great assistant from Professor Wang, Professor Zhang, and of course, dear Rosie, as a great friend. And is our center our center is opened at 2017. It's a private center with my partners, Dr. Rania, Dr. Fauzi, and Dr. Nagla. I am the head of this team. They are all friends, and we have a GC machine. And this is our experience about the HIFU. We treated 506 patients. 308 is complaining from uterine myoma and adenomyosis. About 200 cases complaining from malignant tumor like liver, pancreatic tumors, liposarcoma, aggressive fibromatosis, and benign breast lesions. And we also treated bone metastasis. We haven't ultrasound contrast in Egypt. Of course, I learned HIFU in Chongqing and Suning under observation of Professor Zhang, and of course we have many friends from African countries visit our center, and we are honored to arrange the first training company outside China in our center. This is Professor Shen and all our friends, and of course Raymond's my dear friend, and Dr. Wang, Dr. Ruzi came to our university, Cairo University, and my medical hospital. Of course, it's a different story from my opinion. As I am interventional oncologist and working in interventional techniques, I am searching for a new modality can help the people more and more to treat difficult tumors we can't treat regularly. Like cancer pancreas, I treated cancer pancreas with nano knife. It's very aggressive and it's a difficult technique. As bone tumors, we treated by even with surgical drilling and put needles to ablate the tumors. So it's a long story to find a new technology helping the people, and it's valid for many types of tumors. To understand what is the importance of HIFU, we must know what is the level of research and proof we are now in the HIFU. In the HIFU, now we have an FDA-approved treatment like brain essential tremors, neuropathic pains, Parkinson's disease, back pain, and osteoid osteoma. All of this are approved outside USA. But in USA now, they're treating essential tremor and Parkinson's with HIFU. Also, the oncological application of HIFU is progressing day by day. Now in Europe and all over the world, they can treat the cancer in bone, prostate, breast, especially in Japan. Now they are doing very well with cancer breast in HIFU, with HIFU, cancer kidney, cancer liver, and we have a good experience for liver cancer in Egypt. We treated more than 100 patients now with cancer liver. Pancreatic cancer, we treated almost around 100 cases. Soft tissue tumors, we treated osteosarcoma, liposarcoma, bone metastasis with very good results. So we also, another proof for the validity of the HIFU, this is a statistics from the Foundation of Ultrasound, revealed that the total registered number of the patient treated with HIFU is more than 250,000 patients. And I think there is many patients unregistered at these statistics. And we have uterine fibroid, it's almost half of the patient, prostate cancer, liver cancer, and this is a large number. At the end of the story, now we have FDA approved technology, we have FDA approved application, we have CE and Korean FDA and the Chinese FDA approved techniques like cancer liver, like adenomyosis, like cancer pancreas, and we have now this also the graph of the number of the center all over the world. You can see there is a great improvement in the number of the centers treating HIFU. And the astonishing thing, most of these centers located at Europe, and this is very important. So another issue, as you know, the reflection of the importance of any technology, how is the progress of manufacturing of this technology? You can see we have ultrasound guided HIFU, and which type I prefer, MR guided HIFU, MR guided and ultrasound guided HIFU, camera guided HIFU, and we have now about 28 manufacturers all over the world going to increase the number of HIFU. And this is very important. You can see this is the practical application of HIFU all over the world. And you can see this is the Europe, most of the center located at the Europe. And of course at Asia, China, India, South Korea, and we have Middle East also. You can see our machine ultrasound guided HIFU Chongqing is the best all over the world, as it's valid for many peoples, and also all the people can train on it easily. And this is very important because I have an experience with MR guided HIFU and ultrasound guided HIFU. And from my point of view, I went to many countries to receive and trained for an HIFU treatment, because when I wanted to bring this technology to Egypt, I decided to use this technology, which ultrasound guided, and it's more safe and more feasible. So how the HIFU improve the treatment for the cancer patient, not only for the benign treatment. The HIFU is proved to have many action to destroy the tumor. First of all, tissue destruction by thermal abrasion, histotripsy, and microvascular disruption. Second technique, and which is very important in oncology, it's immunomodulation. By thermal effect of the HIFU, there is tumor cell disruption and the augmentation of immunotherapy drugs. And this is proved by many papers and research. And at the end, the drug delivery, which cause improvement of focal delivery of therapeutic agent to tumors like cancer pancreas and even in brain metastasis. Now, MR guided HIFU making a pore in the membrane of the cell membrane of the brain, allowing the chemotherapy to cross blood-brain barrier to reach the chemotherapy for brain metastasis. So the HIFU is break even in the medical field. So again, we have a mechanical destruction, we have a drug delivery augmentation, we have improvement of the chemotherapy. Again, tissue disruption, immunomodulation, improvement of drug delivery, and even secondary radiation effect. Before you working with the HIFU, you must know very well the anatomy, how to use a proper position for the patient to get the most benefit from the HIFU. You must know very well the surgical approach for every tumor, what is the surgical approach for osteosarcoma, what is the surgical approach for liver, what is the surgical approach for the fibroid, to know very well which plan and which line you treat. Of course, you must be oriented by some of physics, like a direction of power and what is the reflected power produced from the HIFU. And at the end, you must know how to use the least power. As a rule, if the tumor distance, the tumor size, the tumor vascularity is less, you will get a better benefit from the HIFU and you will treat it in much shorter time. Brief, this is the theory of HIFU. We concentrate a power at the point far away from the transducer by 12 to 16 centimeters. And you have a coagulative necrosis effect as you increase the temperature to reach 100. The machine is very easy to use. You can make a semi-automated plan for the treatment of the HIFU, for the treatment of the tumor. And at the end, the patient is stable and you move the machine to make line by line, slice by slice. And at the end, you get a volume from tumor ablation. You can see, this is the idea. Of course, the most popular is ultrasound guided. We have also MR guided HIFU. In most of the patient, like liver, like pancreas, like fibroid, the patient are put in prone position over the tank, and you have some accessories to compress the bowel, like this. And the HIFU machine, ultrasound guided HIFU machine, is very nice as you have many accessories to move the probe. And at the end, you can see very well the tumors. As you see, this is a pancreatic tumor. In the regular work, as a radiologist and as a practitioner for ultrasound, it's difficult to identify the pancreatic tumor very nice. But with HIFU machine, with water media, with a compression, you can identify the pancreatic tumor very well, and so you can safely ablate it. The average time of most of the procedures is about 2 hours, like cancer liver, cancer pancreas, cancer uterine fibroid. This is the total time of operation. And the actual time of operation usually from the actual time of sonication as the patient treated with HIFU is about half an hour to 1 hour or less. So first of all, I will talk about the most difficult tumor growing with least treating procedure all over the world. I'll talk about the pancreatic adenocarcinoma. It's one of the most aggressive cancer. The overall survival is 2 years. Always there is comorbidity. The patient is old, and the vascular inclusion of the tumor. Most of the patients are inoperable, and most of the patients are terminal. You can see this is an anatomical guidelines around cancer, around the head of the pancreas. You can see there is a lot of vessels, a lot of biliary tree. It's very difficult as a surgical technique, and usually the patient discovered late. Also, we haven't a lot of chemotherapy for this patient. Only we have 4 FDA approved agents for cancer pancreas. And the funds for the cancer pancreas is very low all over the world. We have only a nano knife, and this is very important. Many people talking with about HIFU, ultrasound guided HIFU, as well as the certificate for FDA, it's not proof, and etc. etc. This is not right. The FDA approved a HIFU technology as a treatment for many, as a technology for treatment for human medical diseases. And this is a very good situation regarding the safety and regarding the efficacy of the treatment. This is like FDA approved the nano knife, but in contrast, the nano knife, we have only very few patients treated all over the world with this technology. So the HIFU in pancreas is rapidly providing rapid pain relief also, and high safety, and it's non-invasive. This is a biggest, I think, meta-analytical study published from Netherlands, talking about the application of cancer pancreas in HIFU. And you can see the ultrasound guided HIFU is more solid and providing better results. And also it's improved so much the treatment of pain in the patient. And our group in Egypt published 2 papers, one in AUM and one in Vienna, talking about the effect of HIFU on the tumor and on pain. This is our paper published in USA, talking about the color Doppler assisted technique to delineate the boundary of the tumor. As you can see, this is the tumor. We can see the celiac trunk very well. We can hit the tumor very well. And this male is 59 years old, complaining from large 6 centimeter locally advanced pancreatic cancer. You can see this is a locally advanced pancreatic cancer. And this is the side of the tumor. We treat this patient with 2 sessions. And you can see after 9 months, the PET scan is free, completely free. And by MRI, you hardly identify the tumor. There is almost, the tumor is vanished. And of course, the PET scan showing no activity. And this is very important. Also, this lady complaining from large tumor, receiving chemotherapy with progressive course, we decide to treat it with HIFU. And you can see this is a tumor, ablated tumor, and this is the vessel, not injured, and this is the metallic stent. Another one with very small uncinate process tumor. The patient refused to surgery, and this is the tumor. We're treating this patient, and the patient is still living for 2 years and even refused to receive chemotherapy. And you can see this is the uncinate process now. It's clear. You can't even identify the site of the previous tumor. Another issue in Egypt is the hepatic tumors. And the hepatic tumor is very, very common in Egypt because we have a virus C. And this is my study in the MD about radiofrequency for hepatic tumor. And the question is public question in Egypt. Does the HIFU really work in the liver? Because the liver is very difficult. We have reps. It's a very deep organ. And I'll just show you a proof from Hong Kong. This is the group of Hong Kong treating liver with HIFU, and they show us results from HIFU, and even it's equal for results. I'll show you some of our cases for liver, like the pancreatic cases. This is a small metastatic tumor related to the portal vein for this young lady complaining from metastatic colorectal cancer. This is the tumor, and we can delineate it very well. And this is just after the treatment. We make an ultrasound for the patient. You can see the hyperechogenic tumor, and this only for 60 minutes. And the MRI now show the complete ablation of the tumor. There is no enhancement, and the portal vein is okay and intact. The another one, another metastatic tumor in the left loop. As you can see, we can treat right and left loop. The left loop, and this is during the technique, and this is after. You can see we can ablate all of the tumor without any activity. Another lesion at this area from also colorectal cancer metastasis, we can see this is a wedge-shaped ablation with very efficient results. This is another case with cholangiocarcinoma, and all of us know the cholangiocarcinoma is very difficult to treat it. And this guy came to us from country outside Egypt. With central cholangiocarcinoma, we apply a HIFU for 2 hours, and this is the result. We ablate all the tumor, and now, till now, this guy is 2 years ago, contact us in Egypt and sending his grating every now and then, and he's still alive. The fibroid in Egypt is similar to all of Africa. Most of the patients are virgin. They are the most are complaining symptoms is bleeding, and some of them complaining from pressure symptoms. Usually it's multiple. We have now 7 HIFU babies. I'll show you some of our experience regarding different side of the HIFU. This is a common classical large one with very good ablative. This during the HIFU. This is MRI after the HIFU. As another one complaining from abnormal uterine bleeding. This is a posterior wall. The first one is anterior wall. The second one is a posterior wall. We can do anterior and posterior wall. The third one is very large with heterogeneous picture in MRI, and this is very important. Don't worry about the heterogeneity. Not always you need to hypovascular or hypointense. No, the heterogeneous fibroid tumor is okay. It will respond very well to the HIFU treatment. Don't worry about the multiple fibroid. You can treat all these fibroid at one session, but take care. You must know what is the maximum volume you treat. You can treat cervical fibroid, large cervical fibroid. Don't worry, you can treat it. This is a large cervical fibroid, and this is the result after the HIFU. You can, maybe you can get a very good result at this patient, very large tumor. And you can see after treatment, it's ablated very well. And even the slough and the uterus gain, it's normal shape. Even if you have a partial response like this lady, we ablated. Don't worry, maybe it worked. Just follow up the patient. The bleeding is stopped and it's get well and get well again. Again, as an oncology interventionist, I wanted to push the boundaries of the use of HIFU. You can see the guided HIFU now, it's very, very famous for treatment of soft tissue tumors in pediatric age group. And this is very important. And we have Professor Sharma from India. It's working in USA with very good experience. And of course, in China, we have a great professor like Dr. Chen and Dr. Zhang. They're treating these tumors very, very, very nice. So we're starting to do this in Egypt. We're starting to expand our boundaries with HIFU. Like this baby with large neck tumor treated many times with sclerotherapy and with not improvement so well. We make a very low power for treating this solid component of this tumor, and you can see this is before and this is after. It's of course not completely disappear, but even this girl can extrude their tongue outside their mouth before she can't. And this is good. This is a step forward. This guy from Iraq is complaining from aggressive fibromatosis and operated many times before, came to us, and I decided to make an angiography before it to see the vascularity, and I did it myself, and make an embolization with particles, and then make an ablation on 2 sessions for this fibroid. And you can see we can even ablate more than 60% of the tumor in 1 session. Again, this young lady with aneurysmal bone cysts, you can see this is the tumor, and we can make a HIFU for the synovium of the wall of the aneurysmal bone cyst. So, HIFU will take a very good role in treatment of the cancer, especially with increasing the effect of the immunotherapy. And I think this will be the surgery of the future. Thank you very much, and thank you for attendance.